Dalja is joining us now. He's an infectious disease expert and senior scholar at the Johns Hopkins Center for Health Security. Dr. Dalja, thank you for joining me. I'd like to first start with this breaking news regarding the Chief of Staff for Vice President Pence, Mark Short, tested positive for COVID-19 yesterday. Mr. Short traveled with the Vice President to Indiana on Thursday. And then another senior political advisor also recently tested positive. His name is Marty Obst. Now, he also often travels with Mr. Pence, which means at least 5 close aides, not all staff, but 5 close aides to the vice president have tested positive for coronavirus in the past week. What does this suggest to you?
It suggests that the vice president is at very high risk for developing coronavirus, and that him getting daily tests is only going to take the risk down a little bit. There probably is a need for him to self-quarantine for 14 days based on the amount of people that are around him that are positive and the number of contacts he probably had with them. I want to know, were all those contacts with or without masks? How long were those contacts? But I do think that there is a consideration there that the vice president has been significantly exposed to the virus.
Now, fortunately, Vice President Pence and the Second Lady Karen Pence tested negative this morning, but he interacted with supporters at a rally in Fort Wayne, Indiana 3 days ago. The Vice President is traveling to Kinston, North Carolina today, scheduled to go to New Hill, North Carolina tomorrow, and then on to Greensboro, North Carolina, and Greenville, South Carolina on Tuesday. So would you say this travel is safe?
I can't say that it's safe. He likely was significantly exposed, and we know that a test is just one moment in time, and that you can't test yourself out of self-quarantine. And I do think that he needs to follow the CDC guidance, and the fact is, if he was a significant exposure, you need to self-quarantine for 14 days, irrespective of any test result. And I think that's what he should be actually held to, that same standard that every American is held to.
Now, the New York Times is reporting, Doctor, that the White House Chief of Staff, Mark Meadows, he had sought to keep the news of the outbreak surrounding Vice President Pence from becoming public. Now, is this good protocol for public health?
It's absolutely the wrong protocol. You want to be as transparent as possible during this outbreak, and we want people to know who might have interacted with the vice president that they could have been significantly exposed, or if they've interacted with the staff around the vice president, that they need to talk to their doctor, they need to think about getting tested, and they need to think about self-quarantining. We want this to be as open a process as possible so that everyone knows what their risk is. And that's how we move forward in this pandemic, is being very open about who is at risk, who isn't at risk, who is infected, who isn't infected. That allows people to take protective actions, and without that, people are going to be in the dark.
Meanwhile, the dark winter, that is, will hit just when President Trump is either reelected, and he's not a big fan of wearing masks or a mask mandate, or during his lame duck period, when he might be maybe less inclined to move forward on mitigation in terms of public health and safety. How do either of those scenarios look through your eyes from the perspective of an infectious disease expert?
We have to prepare for this still getting worse than it is right now. And we're already hearing about hospitals all over the country being inundated, having to set up field hospitals and auxiliary centers to take care of patients. I mean, this isn't the way that we wanted to manage this infectious disease outbreak. And one of the ways moving forward that we can try and decrease transmission risk is by getting people to wear face coverings. It's very simple, and now there is data that didn't exist early on in the pandemic that this can be definitive in getting the burden of infection down, allowing people to go about their activities in a safer manner. So this is something that we need to embrace as a society if we're going to move forward, because without it, we're going to continue to have transmission events. We're going to continue to see hospitals worried about whether they can provide care and altering the standards of care, which we don't want to happen.
And to be clear, you're talking about wearing masks.
Yes.
Okay. Really quickly, Doctor, I want to show you a poll, and it's a new poll from ABC News and Ipsos poll out this morning, saying that 78% of Americans are concerned that they or someone they know will be infected with COVID-19. 22% are not concerned at all, or not so concerned. So lastly, if the virus is more likely to attack and kill brown people, black people, seniors, people with pre-existing conditions, does that mean that people who do not fit that description don't have to wear masks or follow social distance guidelines?
No, this virus can affect anybody. It can kill anybody, not depending upon their race or their skin color or any of that. We know that there are groups that are at higher risk for dying, those that have other medical conditions that are older, and we are seeing a disproportionate impact in Black and brown populations, which probably has to do with some of the risk factors and the fact that many of them are essential workers. But everybody needs to be concerned about this. Not only can you yourself get sick with it, but you could spread it to a vulnerable population or a person who could then end up needing hospitalization or dying. So this is basically a population-wide problem that we all have to take seriously, because if any of us aren't taking this seriously, that allows the virus an opportunity to spread to vulnerable populations.
Dr. Amish Adalja, thank you very much for joining us, and I have to leave it there, sir. Thanks so much.